Welcome to the Faith, Health, and Home digital podcast. I am your host, Makeba Giles. Here we share information and resources for physical, emotional, and spiritual well-being to help families live an inspired lifestyle and encourage healthy living. Thank you for joining us. Despite many benefits, only about half of Americans get the annual flu vaccine. And in fact, during the 2021-2022 season, there was a significant drop in flu vaccinations compared to recent vaccinations the year before. This year, the southern hemisphere has seen high levels of flu-related activity going back to pre-pandemic levels. And some experts believe this is a strong predictor of the upcoming flu season. With the trends we're seeing in the Southern Hemisphere, flu vaccines are more important than ever for anyone 6 months of age or older. Here with me now on how to protect yourself and your family from the flu are Dr. Lisa Doggett, family physician, senior medical director for HGS-AxisPoint Health, and Dr. Gregg Sylvester, chief health officer at CSL Seqirus, a leading global influenza vaccine manufacturer. Thank you both for joining me today.
Thank you so much for having us.
Now, first, Dr. Sylvester, tell us what are some of the concerns for the upcoming flu season this year and why?
Well, I think the big reason why is we're all slowly getting out of this pandemic and we're traveling. And when we travel, so do viruses. And so what we know is that when we see a particularly severe and early flu season in the Southern Hemisphere, it often predicts what happens in the Northern Hemisphere. We know that viruses don't stop at the equator. So we know that if we're not well vaccinated, not only individually, but in our community, then there's a greater risk of us having a severe flu season here in the United States.
Absolutely. Now, Dr. Doggett, why is getting vaccinated against influenza more important than ever this year?
Well, I think getting vaccinated against flu is important every year, but particularly this year, we are concerned about potentially having a worse flu season, as Dr. Sylvester mentioned. We also have been changing our behavior. You know, we were socially distancing and masking the last couple of years because we were concerned about COVID. Those measures not only protected us from COVID, but also kept us from getting flu. Now that we aren't doing those things so often and we're gathering together more often indoors, we are potentially increasing the risk of flu as well as COVID in the winter. We don't want to have flu and COVID happening at the same time. That can overwhelm our hospitals, and we want to do everything we can to prevent both types of infections. Getting vaccinated now during September and October against flu, that's typically the best months to get vaccinated. And you can also go in and get your COVID booster at the same time.
Thank you for sharing that. Now, you mentioned that September and October are the best months to get vaccinated. Why is that?
Well, typically flu season gets underway in the winter months, and that can vary. Usually, November, it may start to creep up, but we then see higher rates as the months go by. But the flu season can vary significantly. If you get vaccinated too early, you may not have as much lasting protection if this flu season is later in the year, and we don't know for sure when it will be. So September and October usually give you your best shot of being protected when it starts, and if it's later, it will keep you protected at that time as well.
Important information to know. Thank you, Dr. Doggett. Now, Dr. Sylvester, tell us, what are some key lessons from recent flu seasons? We know that we're seeing, like Dr. Doggett said, an increase in, more indoor gatherings and things of that nature. So tell us what some key components we can take from recent flu seasons and apply to this one.
Well, let's not forget the last two flu seasons, we saw unprecedented low flu activity. And why? Because of all those mitigation factors that you two have already spoken about. But as we start to re-engage and become part of our communities again, we really need to be protected. And the best way to be protected as an individual and as a community is to get an annual flu shot. Don't forget that we here on behalf of CSL Seqirus think it's terribly important, not just to get your flu vaccine in October in September and October, but next year in September and October, and the year after, and the year after that. It's important for us to get an annual flu vaccination.
Indeed, very important. Now, we know that the vaccinations are now open for ages 6 months and older. Dr. Doggett, what are some people more at risk for flu than others?
It's a great question. Anyone can get flu, but there are certain groups that are at higher risk for complications. Those groups include people that are older. Often people 65 and older are at higher risk for complications. And that group tends to have higher rates of death than any of the other groups and higher rates of hospitalization. But kids are also at higher risk, particularly kids under 5. People with other health conditions like diabetes, or if they have heart and lung problems, those conditions increase the risk of having a poor outcome from flu. So those folks definitely need to be vaccinated. People in their household can help protect them by getting vaccinated as well. And all of us need to do our part to help protect the more vulnerable in our community, but also to prevent ourselves from getting sick.
Yes, indeed, we do. Now, we know that there are still a lot of people that may be unsure about the vaccination and may have questions for themselves as well as their loved ones, and even if they're a caretaker of someone. Can you tell us where people can go to learn more as we head into this flu vac season?
Well, I think a wonderful website is the cdc.gov. It's good for both healthcare professionals as well as the public. But don't forget, go see your healthcare professional, your primary care physician. He or she is going to lead you in the right direction and give you the right information.
Yes, absolutely. Thank you. And again, for more information and to learn more about what to expect this upcoming flu season, visit cdc.gov. Definitely go to your healthcare provider as well for any questions or concerns you may have, and be sure that you and your family members get the flu vaccine this season to protect not only yourself, but your community as well, just like the doctor said. I want to thank both of you so much for joining me today to share this important information. It's been a pleasure.
Thank you so much.
Thank you. This episode of Faith, Health, and Home is brought to you by CSL Seqirus, a global force in the fight against influenza. To learn more, visit them at flu.com. Thank you for tuning in to the Faith, Health, and Home digital podcast. For transcripts of this episode and others, visit our website at faithhealthandhome.com. Also, be sure to subscribe to our podcast and connect with us on Facebook, Instagram, YouTube, and Twitter. Thank you again for joining us.